The anatomy that we've been studying is used to create a variety of common gestures that are used in different speech sounds. We see these gestures in more than one speech sound generally, so you can think of them like the components that get combined together to create a full articulation of a sound. This lecture is going to go through each of the active articulators and the common gestures that are used. The VLM gets used for the gesture of VLM raising. When most speech sounds are produced, the VLM is raised to close off the nasal cavity so that all of the sound of speech is directed through the oral cavity. VLM raising is done primarily by the levator veli palatini with support from the musculus uvulae and the superior pharyngeal constrictor. The gesture of VLM lowering takes place for nasal sounds in English, the n, and ng sounds, and also when you pause to take a breath during speech production. Some lowering is going to happen due to gravity when the levator veli palatini relaxes. However, during speech production, the VLM is actively lowered by action of the palatoglossus and the palatopharyngeus. Turning to the mandible, we have the jaw is an important articulator for our labiodental phonemes, where the teeth are raised to touch the upper lip. Also, other articulations produced by the lower lip and by the tongue are connected to the jaw because the lower lip and the tongue ride on the jaw. So anytime the lower lip or the tongue need to be raised, the mandible will also be raised. Movement of the mandible is also one way to identify syllables in speech. Generally speaking, the mandible moves up for consonants at the beginning of a syllable, down for the vowel, and then back up again for any consonants that are at the end of a syllable. Mandible movement does vary depending on the type of speech sound, though. For something like a p at the front of the mouth, raising the lower lip, there's more mandible movement required. For something like k in the back of the mouth, the mandible movement is minimized. It's probably a little more obvious for vowels, where vowels like oo and o would have the mandible raised. A vowel like ah would have the mandible lowered. The gesture of mandible raising is used for all consonants and high vowels. This involves our jaw-raising muscles, the masseter, the temporalis, and the medial pterygoid. The mandible is lowered for low vowels, using the digastric, the mylohyoid, and the geniohyoid. In addition, infrahyoid muscles would be needed to stabilize the hyoid bone, things like the sternohyoid and the omohyoid. The movements of the mandible for speech are relatively small. Generally, these movements happen by all of the muscles being contracted simultaneously and just adjusting the degree of contraction to be higher for the raising muscles for raising or the lowering muscles for lowering. The lips are a slightly more complicated articulator. These are used for bilabial and labiodental consonants as well as for rounding of vowels. The lips are also actively spread for high front vowels in English, so if you say a diphthong like I or ow, you can feel movement in the lips for both of those and not just for ow with the rounded vowel. Similarly with co-articulation, the articulation of si versus sa versus so involves spreading the lips during the S for si, rounding the lips during the S for so, the lips remaining relatively neutral for sa. Generally, for lip articulations, the lower lip is the more mobile articulator and is going to do most of the work. In speech production, we can close the lips with a strong activation of lower lip and lip closing muscles like the orbicularis oris, both superior and inferior, the levator anguli oris, and the mentalis, helping to bring the lower lip up toward the upper lip. A less strong activation is found in lip rounding and protruding, like in round vowels. So same muscles are involved to some extent, orbicularis oris, superior and inferior, and the mentalis, but not as much contraction is needed if you're not going to make a complete closure. And then for those cases of lip spreading, we have activity from risorius zygommatic major and depressor labii inferioris to pull the corners of the lips away from the midline. The tongue is our most complicated articulator of all. It has a role in almost all of the speech sounds. Broadly speaking, we have extrinsic muscles that control the general location of the tongue body within the oral cavity, and then intrinsic tongue muscles that control details of tongue posture. Putting all our different possible extrinsic and intrinsic activities together, we have a lot of different tongue gestures that we can make. The gesture of elevating the tongue tip, for example, to make a t sound, is done primarily by the superior longitudinal muscles. Depressing of the tongue tip needs to happen for sounds like k and for vowels like e, because you don't want the tongue tip to make contact on the alveolar ridge, for example, because that would interfere with those speech sounds. Depressing the tongue tip uses the inferior longitudinal muscles. For the fairly special lateral sound ul, we have airflow around the sides of the tongue, so the transverse muscles are used to pull the tongue sides in toward the midline. Central grooving takes place in some fricative sounds like s to get you a very loud and high-pitched noise. That would use a combination of vertical muscles and the genioglossus to pull down on the center of the tongue. Contraction of the superior longitudinal muscle will also help keep the sides of the tongue up. Tongue protrusion happens for sounds like th, spelled with a th. Posterior genioglossus helps pull the tongue body forward, and then our superior and inferior longitudinal muscles will contract a bit to help tense that front part of the tongue to be projected between the teeth. After that tongue protrusion is done, we have to have tongue retraction. Anterior genioglossus muscles will pull the tongue tip downward and back into the mouth. Styloglossus muscle helps pull the tongue body backward, and superior and inferior longitudinal muscles can also help retract the tongue tip by contracting more strongly than they would for tongue protrusion. The tongue dorsum is elevated for those high back sounds like oo and k. This involves the styloglossus and palatoglossus muscle supporting elevation of the tongue body and contraction of the transverse muscles to help bulge the tongue body. By pulling in on the sides, the transverse muscles will cause the top of the tongue to bunch up. Tongue body fronting for sounds like e and sh require the tongue body being pulled forward by posterior genioglossus, and again, transverse muscles pulling in on the sides of the tongue body to elevate the bulk of the tongue upward in the oral cavity. As a contrasting gesture to these elevating type gestures, we have tongue body flattening for a low vowel like ah, for example, where we want to bring the body of the tongue down. So anterior genioglossus will pull on the anterior part of the tongue, hyoglossus muscle will pull on the base of the tongue toward the hyoid bone, and vertical muscles throughout the tongue will help flatten out the tongue body. An example of a more complicated kind of question involving these concepts of different gestures would be to talk about a contrast between English and another language, for example. So in Thai, there's a vowel that's a lot like our oo vowel, except that the lips are spread rather than rounded to produce an e sound. If we were going to compare the articulation of the standard English oo vowel and this Thai vowel with spreading, what difference would we see? There's a lot of language in the question here, but the crucial bit is basically that we have lip spreading taking place rather than rounding, so we would be trying to identify a difference in terms of muscles involved in either lip spreading or lip rounding. In this case, then, we have just one of our four answers that involves a lip muscle. That's the risorius, so that would be the best answer to this question. an example applied to clinical cases. In some cases where there's a bad oral cancer, the tongue may be removed. When this is done, sometimes people get a tongue prosthesis, which gives them a mass inside the mouth that they can move for speech, and it can help in eating. But a tongue prosthesis doesn't have any intrinsic muscles in it like a normal tongue does. So given this clinical situation, there's one speech gesture in this list that someone with a tongue prosthesis wouldn't be able to do. Among our choices, then, we'd be looking for a speech gesture that crucially involves intrinsic tongue muscles as opposed to extrinsic tongue muscles. Best answer here is central grooving, changing the shape of the tongue by putting a groove in it, in contrast to the other answers like tongue body fronting or dorsum elevation, which would involve moving the mass of the tongue around, or VLM lowering, which doesn't really particularly involve the tongue at all.